levels of noradrenaline in the brain in patients with PTSD are too high. And it turns out at the same conference, it was one of those incredible moments, you get hairs on the back of your neck. There was a psychiatrist from Puget Sound, which is just outside of Seattle on the west coast of America. And he had been treating his war veterans in the Veterans Administration with a blood pressure medication called prazosin. Now, it turns out that prazosin, it's a generic drug because it's the Veterans Administration, so it's cheap, and it crosses the blood-brain barrier. When prazosin gets into the brain, one of the things that it does is shut down levels of noradrenaline. What he was perplexed by is that he was saying, I'm giving this blood pressure medication to my war veterans with PTSD. It's not helping too much with their blood pressure, but they're all coming back saying all of those repetitive nightmares, they're starting to go away, and I'm sleeping better and I'm feeling better. What he had done was inadvertently treated their high levels of noradrenaline, which were preventing the brain from kind of dropping those levels of noradrenaline down and processing the emotion from the memory. It was too high in those PTSD patients, but by treating them with this drug, he'd inadvertently brought the levels of noradrenaline down during REM sleep. And then it ultimately became one of the only prescribed medications in the Veterans Administration for repetitive nightmares. And I would say that there is now a better treatment for nightmares if you're suffering from nightmares. And it's called image rehearsal therapy, or IRT.